8:12 now at News Talk 96.5 KPEL this Tuesday, July 3rd, 2018. I'm just going to call for last Friday through tomorrow the 4th of July weekend.
Yeah. I think
because let me tell you, I'm looking out. I don't see cars on the road right now.
It's true.
Say Senator Fred Mills joins us on the phone.
He's the only person working today.
Yes, he's in studio with us. And banks are apparently open because you have a meeting today.
Yeah, but this was the easiest ride I've ever had from Brobridge to Bertrand. I made it in record time. I think that the show should be televised. Broadcast in Destin. That's where everybody's at.
I think that's probably a good idea.
Well, here's the deal. Now
Phoenix
that they
West.
have...
Yes. Turquoise Place.
Now that they have A-Bear specialty meats in Destin, I think KPEL needs to be on in Destin.
Oh, I think we need to do a serious investigative series.
Exactly, but that's where
impact
there is no one in town on the roads.
Yes.
Either they're all sleeping.
Yes. All right. So, first of all, this is the first time we've talked to you since the end of the third extraordinary session.
It's the extra special session.
Well, I think that's the dumbest word ever because it's not extraordinary. It's sad.
And it's not special.
I understand the legal term for that. So we're done with that. We talked to Commissioner Administration Jay Dart a little bit earlier on this morning, who was really just very proud of himself for his role in stabilizing state government spending.
Right.
He actually even used the term not now that because we are living within our means. And I have to, as someone who asks questions for the people, I have to ask, that's not within our means. People would take issue with you saying that's within your means because we just had to renew an expiring tax to do it.
It was a temporary tax, by the way.
That's right.
So,
that's right.
So anyway, I guess it all just depends. I mean, theoretically, I could go buy a $90,000 vehicle today, but my wife would not be happy when I got home.
Yeah,
and it wouldn't be responsible.
And your need may not be her need.
Yes.
That's
exactly. If it's a truck, that's for sure.
Exactly.
Yeah.
So where are we with, stable by some measure? I mean, guess what? If you're Moody's, of course they're stable.
They look at that and they go, okay.
They look at the stable revenue stream.
Right.
That doesn't mean the revenue stream is spent correctly. It's that the revenue stream is hopefully predictable and it can be used either for bonding purposes or for forecasting. But that's a whole different thing than the expenditure side, which when I was driving over here with absolutely no traffic, I could concentrate on the show a lot better.
Right.
And I heard y'all talk to Jade Arden and the open checkbook and see where the expenditures are. And as we'll talk about with the LDH issue, the expenditures is the key piece.
Okay, so let's talk about the checkbook real quick. Then we're going to get into the DHH situation.
Sure.
Okay, now we have asking questions. That's what we do.
Right.
Okay, so when the discussion came up about the checkbook on the many occasions that it has over the past year, if you will, and Jay Darden even referenced it in the interview that we had, it was also a question of how much information you give. And that is a difference in philosophy for some people. Okay, fine. We're paying for it. Every person that pays into the tax system is paying for that. It's our checkbook.
That's right.
Right?
That's right.
So there seemed to be some reluctance at some point from the administration to not do this. And they said it would be too hard and be very costly to have it all switched over. Now suddenly he's all like they've been doing it from the beginning. So am I misinterpreting something there?
Yeah, I was hearing the broadcast
was
and
it
the
kind
questions.
Of a disconnect for you too?
It seemed that there was a disconnect.
It failed.
Yeah.
I thought they weren't behind it, and it failed. And then what he said was, well, no, there was just some difference on how much information we wanted to put on there and our ability to put on there. But we know because we've talked to the
ability to put that information
we've talked to the
there.
school board who has used the same company here in Lafayette Parish, same company that
As
did the Ohio
right?
checkbook. And you know what he said? It's as simple as whatever software you use, it has to be able to export into an Excel file.
Exactly.
And guess what? I'm sure that's what we have.
And as Bernie said earlier, Rob, one of y'all said, all the information is public, so just put it out there, but put it out in a form that's retrievable and you can.
Yes.
I did hear some of the Senate finance debate, and the debate wasn't the pros and cons of it. It was more implementation cost and recurring cost.
And I think that's understandable.
Sure.
At the same time, I think that there are motives behind the scenes there for a lot of people. Maybe if you're that guy who is supervising one employee, you don't want people to know about that because your gig is good. I would love to say, oh, yeah, I'm I'm getting a supervisor's salary and I only supervise one person. That would be glorious. And I'm not saying anything against state workers, because we hear all the time from people who work 60, 65 hours a week, 70 hours a week. They're busting their buns. But then there are a lot of people you sit around wonder, what do they do all day?
It's going to be very interesting when I'll use the thing with the NFL.
Mm-hmm.
You know, when you figure out how much the running back making and the quarterback's making and the poor tackle that's blocking is making so much less. It's going to be interesting when the state employees start seeing that, hey, here's the worker working really hard making $30,000, and here's the senior executive making $180,000.
And they don't do anything in some cases.
That's going to be interesting internally.
Oh,
that's going to be very interesting internally.
Well, and would you not question whether or not lawsuits can be filed based on that, especially if you perhaps are a female in a position where you should be paid equitably to a man? It's
going to be interesting, classified positions versus non-classified. There could be a Hatfield and McCoy's fight just within the ranks themselves.
I would undoubtedly, and that is all bureaucracy in all administrations. It's not just picking on one administration. This goes back for years in Louisiana.
Yeah, there may have to be a good rain to clean the road up a little bit.
I'm wondering.
But whenever they said that, and Bernie asked the question, you start to say, well, is there really such thing as too much information?
No, there never is. Because what's going to happen is, in anything else, you see it in corporate boardrooms, the more information you have, the more diversity you have in discussions, and the more it brings out. I know when I was on Senate Finance and we'd look at the data, just the committee members had so many questions and they saw information from a different light. And when you see facts and information, we all may see something different, but we're going to talk about it. And I think it'll be good.
And I think private organizations, private social groups will get together and gather and look at this information and then be asking questions. I have heard of different groups across the state who have already started to hire their own investigative reporters to look into certain situations. And I think it's a wonderful thing, because then you can't play politics one side against the other. It's about the bureaucracy. It's not about what the letter is behind the name. It's about what's happening for the taxpayer, and are they getting the best bang for their buck?
In French, I would say it's going to be a good tracas. It's going to be a good tracas.
We're joined by State Senator Fred Mills. I want to take a quick break and come back and talk specifically about Medicare fraud. Medicaid fraud. Can we prove it? How big of a problem is it? And about the DHS.
Or DHS, the letters that went back and forth between the secretary and you. There is nothing wrong with asking questions. If you're offended, and I'm not talking about her, I'm talking about in general. If you are offended, if you work in government and you get offended because somebody asks a question, and she didn't, I'm not saying that. Right. I'm just saying in general, that right there raises more red flags for people. You can't get offended because somebody wants an answer to a question when they're the person paying for it.
That's right.
All right, we'll ask those questions. Coming up on the show.
My God.
There's a few buttons on this side.
8:22 now at News Talk 96.5 KPEL. Yes, Bernie is definitely in charge over there.
Oh, okay.
She has the ability to shut me up, as I'm sure a lot of people would love to. She actually can do it, though, because she could press off.
It's like she's doing a control panel at the Doobie Brother concert.
Yes.
I mean, it's like unbelievable.
With no Doobie.
I was about to say, not
and
nearly
no
as
brothers.
high.
Exactly.
Well, speaking of medical marijuana.
Fred, how's that going?
We'll jointly talk about
it. Okay, so you sent a letter over to Dr.
Secretary Rebecca Gee.
Secretary Rebecca Gee over some, we keep seeing numbers from Legislative Auditor's Report. We keep hearing about fraud. We keep hearing about how much it's costing the state. You've been asking about it for a long time. Yet there are still some things that just aren't being done or not fast enough. Kind of update us on that letter. What did it say, and what was the response?
Sure. Well, to try and make this real condensed, and we'll throw out the questions, is on Monday, the day after the special session, a legislator's public report came out and basically said that Louisiana Department of Health and Hospitals is gathering provider data, the people that provide medical services, and they had a checklist of what the federal government requires, and that checklist was not met. And not only was it not met, but there's 5 managed care organizations that basically implement the Medicaid program. And in that, those providers were not accredited with the managed care organizations. So several questions arose. One, are they legitimate providers? Two, where are their locations? Three, because you didn't have detailed information, could a dentist be billing for open heart surgery and there were no edits to catch it? Absolutely no edits. So when I looked at the audit report and I looked at the findings, and the response came back from the department is, we'll explore it, we'll review it, we'll study it, we'll see what's going on. That's not good enough. So I basically contacted the secretary on Monday, and I said, listen, I it's not my style, but I need to put out a letter to you formally, and we need to make these discussions very formal. I need responses on each audit finding, and I need to know where is your plan of action moving either retroactively or prospectively.
And we're talking about a time frame of between when and when? About
2012 to now.
Okay.
And in the report, it shows that basically the data is so simplistic and the data is not what's required by the federal government that auditors cannot truly come in because
they can't really tell you.
They can't come in. So we can't tell where these providers are located. We can't tell what the provider's specialty is that's credentialed. And
did they even really provide the services?
We don't know. Now the department has come back with a rebuttal that they say it's done. They say it's all done correctly, and they say moving forward prospectively, they've gathered more data. What this did was probably open up more questions than answers. So yesterday I got on a pretty lengthy conference call with the legislative auditors and the auditors that did the report.
Right. Okay.
And I said, let's take my letter. Let's take the secretary's letter. Tell me what's still causing you some pain. So they got really deep into it. And what they basically said was that they have no capability to do mass audits because there's not enough information into the system. And they question whether prospectively they're getting enough information.
I mean, because you can theoretically have someone who ends up registered some kind of way, charging the state for patients they might not even be seeing.
Right.
Correct.
It might as well be an operation done online. It's someone sitting in their garage.
And the secretary
and
the secretary contends that has not happened. But how do we know? Can we prove that hasn't happened?
They are saying, and listen, there's two sides to the argument. And
Absolutely.
I have to give them credit because they came back in 2 days, they came back with a response letter. And what the department's saying is, we've done what needs to be done, but until we can get a single registry to talk to the 5 managed care systems and get what we need in place.
How can they not have had that before, Senator Mills?
That's what's troubling me. And what's troubling me even more is I'm getting more legal opinions is the federal government pays the massive percentage of the bills on Medicaid.
Yeah. Right.
There's rules we have to live with the federal government. And if we don't live within those rules, they can come back and say these payments were made improperly.
Absolutely.
Here's a clawback, and we've experienced that where we owe some bills.
Yes, because there was a lawsuit, 15, 20 years ago about a similar kind of thing in Louisiana.
Exactly. So what I'm concerned about is the federal piece. Are we in compliance with the federal piece? Now, legislative auditors told me something yesterday was even more troubling. They said when they've talked to the federal government to see, okay, is this a mortal sin or a venial sin, and where do we stand with it? They say that, yes, it is improper, but most states are systemically having these problems. That's troubling on
because it's a bureaucracy issue.
Yes, so it's very troubling. So I think the next stage of this process is to get into a discussion where we all face-to-face with the legislative auditors, the department, and talk about where do we move this thing through next. And that's kind of my next work I'm going to do on this. But I will tell you, I questioned one of the top MCOs in a committee hearing, and I asked the head of one of the MCOs, I said, what keeps you up at night? And he said, well, what keeps me up at night is there's going to be a major cybersecurity breach. There's going to be a multi-state provider fraud ring. And when that happens, heaven help us all.
I suggest that what if it hasn't happened already?
That's right. And what I've been really preaching and hollering and screaming about, I guess from my banking experience, and I'll use the experience of the Equifax breach.
Yes.
If a major breach takes place and there's major fraud and money comes out of the door, who pays that? Is it the responsibility of the managed care organization, or is it Louisiana Department of Health? And this past session, we passed some legislation at our sponsor that basically said whoever is at the fault of the breach eats the money. And it shouldn't be there. So right now, I guess the question
How can
is,
this be
That's
in
crazy.
2018 that we are left open to all of these vulnerabilities?
there's enough vulnerability right out there if you do it right. I mean, if you do
Yeah,
everything right,
absolutely.
there's a vulnerability.
Absolutely.
But this is the situation that I'm not sure if the right hand is knowing what the left hand's doing.
And that's the bureaucracy. That's not,
And
Well,
it's
also probably just people being naive, because I guarantee you that's why other states are having the same problem.
Absolutely.
Because they worked in this system where,
Well, and
why
when you
would
have-
anyone ever make up that they were a doctor?
Rob mentions a great point. And you
Yes.
see, years ago, before 2012, you had one single layer of payment. You had a fee for service that the department did. So when they verified and credentialed and registered a provider, that was all under one umbrella. But now you have the department gathering the information, putting it into a registry, and you have 5 managed care organizations that are doing credentialing separately. So at the end of the day, Dr. blah, blah, blah from wherever could be recognized by the department, but the MCO doesn't recognize them, or vice versa. The MCO could recognize them, and it's
I know, but how could we allow that in itself, that mechanism to exist in a taxpayer-structured system is my question.
And that's where, thank goodness, we have the legislative auditor. And many times, as chairman of health and welfare, they'll come to my office and say, what issues do you think we have some problems with right now? And we'll kind of come up with an audit schedule. Now, they have their own,
Right.
but I'll come back and say, listen, I received complaints on X. Could you examine X? There was a board the other day that I had a tremendous amount of consumer complaints, called legislative audit, that they're right now deep into that board, and there could be some major findings taking place.
Okay, so that could be another potential situation.
It could be. It could be. There could be some issues. But a lot of times, and I would tell the KPL listeners, because they're very vigilant, if you see something wrong, let your legislator know about it, because we will ask for an audit on it.
So if this has been going on since 2012, who's been, why has it not been remedied? When the situation began in 2012, can they not go back to whoever was in charge at that time and ask why policies were not put in place to remedy the problem at that point?
The legislative auditors tell me they are, but they're basically saying we have to partner up with you guys as legislators because we just have so much power.
Right.
I mean, they really, they like your auditor that comes into your place of business.
Sure.
They can tell you what you're doing wrong, but sooner or later, somebody has to be big brother.
Right.
And in this case, it's the legislature. And in this case, a lot of it is the Health and Welfare Committee, because we do have the power of oversight. We do have the power of doing certain things. And, you know, a very important thing of a legislator is, you go into session, you vote on bills, you also do constituent work, but a major issue is that oversight over the jurisdiction of law that you have. So if this doesn't get resolved and we can't work this administratively, the next phase will be an administrative hearing, an oversight hearing with the Health and Welfare Committee.
I would think so. And then has anyone spoken to the governor? Has there been any letter that's been written to the governor to ask what his thoughts are?
I contacted the governor before I sent the letter out, and I said, Governor, I want you to know I've looked at the audit, and he took this very seriously also, and he talked about some of his 2012. He thought prospectively they were moving forward, but he welcomed it. He said, listen, if that's what you and the committee need to do, I'm not going to oppose this. And I said, well, I want to call the secretary, and I told her, I said, look, this letter's coming, and we have to have a paper trail. It has to be in writing, and there has to be a resolution to this.
Yeah.
So,
Wow. I just can't wait to kind of hear where it goes.
and I'm happy to come back and report, but this is...
Can I just ask one follow-up, just real quick?
Sure.
You've been in government a while now.
Yes.
We're always talking about something like this.
You know...
What is the problem, Senator? What do you think?
And, you know, to be positive, we
I
could
know.
talk about a lot of great things happening. I mean, there
Oh,
are.
there are.
And our job is, and I think our job in any job, I mean, there's a lot of KPL listeners that have businesses. You can talk about what's good about your business, but
Absolutely.
you have to work on the shortfalls. You have to work on where you have some threats and weaknesses, and you have to address it. So, I mean, we could sit here and talk about the great work the public-private partnerships are doing, the human
absolutely.
service districts are doing.
Oh, my God, yeah, because those public-private partnerships, we have seen an amazing change.
But our job
this
is to
community.
look at the problems and go forth
It's
there.
both
and-
sides.
Yeah, so
Yeah.
you kind of have to dig
But
those out.
Why do you think we keep having some of these issues in Louisiana?
I think they systemically all over the United States.
Okay.
I really do. From yesterday's conversation, I have to tell you, Bernie, I kept just asking the question. I said, are we an outlier? And the legislative auditor said, no, on this part, we're not.
But think about that. This is America where we're supposed to be better.
Exactly. I know.
So many, is it the possibility, and we're not saying it's happening, but is it the possibility that governments all across our country are being fleeced by who knows who?
Well, and listen, you're right, but there may be no Medicaid fraud in this. There may be.
God, let's hope
not. But
not.
we're just trying to say the tools for the Attorney General's office, the tools for different departments, they can't do a reasonable audit unless they have good, credible data. And what the legislative auditor is saying is, I don't have good data, so I don't know if there's fraud. I don't know if there's
And how are they going to go back and get that data?
I think it's be tough to put the toothpaste back in the tube. I really do. I'm going to keep trying to see if we can.
I know, right.
But if we can't, we have to at least make sure we're moving forward.
It's 2018.
Yes.
It's been going on since 2012.
That's what the audit says.
Systemically, the audit says that.
And I have
in 6 years, it still has not been fixed.
And when I got this on my desk on Monday, I said this is something that we have to put a lot of elbow grease right away, at least to find out what the hell's going on.
Absolutely, because people are going to sit back, oh, y'all hate this, and y'all hate that, and y'all don't like this, and you don't like that. But then you're going to have people running up to the microphone saying, there's nothing wrong with things in Louisiana. We do it just fine.
And that's why I felt this time it had to be documented in writing, and I thought there needed to be a paper trail for all sides.
In 6 years, it hasn't been straightened out. What the hell is going on?
Yeah, I agree.
And I don't care. And what if it's not just that department? If it is systemically across the country,
I know.
It's heartbreaking. We can do so much better.
And we have to. I mean, we really should. So, to kind of wrap a bow around it, it's a problem. The problem's been addressed back to me with the department. It opened up more questions and answers. So I think the next phase is to drill down even deeper on the answers that were given to me last week.
How shocked were you?
I don't know if I was shocked. I was like, okay, this is a problem and we got to hit it right away. I mean, just right away. Because we're in a different age than we were 10, 15 years ago. I mean, you can look at all of the breaches that are happening. I mean, the Target breach, the Sonic breach, the Equifax, the Home Depot breach. I mean, to me, if I'm going to really, really do a breach, it's going to be on providers. And basically, there's going to be, 80. Well, let me give you just another quick example, Bernie. Without the data, they can't figure out if a provider did so many services within a certain period of time.
Thank you.
So maybe I'm a cardiovascular surgeon and I said I did 40 open heart surgeries today. Well, without the data, I can't figure out if you did 40. And if you did 40, I'm coming to the office saying, okay, there's no way. There's no way you did 40.
Did that in that amount of time.
So we're going to recoup
the
this.
Money?
Yeah, we're going to recoup this. We're going to report you to your board. We're going to look at your licensure. We're going to
Now, Fred, at the end of the day, that's what it's about.
It truly is. It truly is.
And let's hope that none of that happened.
And look, I can give you some more examples if you want to stay on. I can give you some more things that are out there that
can we ask?
Yeah, we'll take a break. We'll come back with more with State Senator Fred Mills. Great information as always. All right, so I want some of those specific examples. You just mentioned about, what do you say? A cardiac surgeon who might say they're doing 40 procedures in a day.
And there's no coding to necessarily know if this is a legitimate provider, for example?
That's what the legislative auditors told me yesterday.
Okay.
I was on the phone yesterday. I said, okay, because of the simplistic information is being put in the system and it's not being expanded like it's mandated to be expanded with certain specialty codes and certain things that you need to do an audit, what don't you have? Mm-hmm. And the auditor quickly came back and said, well, I don't know, first of all, if maybe 20 services are being provided at 10 locations, but you're not, I can't figure it out. Second thing is, I can't figure out what's the norm within a region for services.
Okay.
So if a service does 6 colonoscopies in a day, but all of a sudden, because I can't link that data together, and if I could link it together at one site,
I would know.
They did 30 colonoscopies. Well, then I would go in and do an audit and see what's going on. I don't have that capability to audit it. And not having the capability to audit it, I am not doing my job to the taxpayers of Louisiana to come back and say that I fully understand the complexity of the services delivered.
Right.
And that's where,
but then we can't be unique. And I know you said some other states are having the same problems, but I mean, you just look at the number of providers we have registered versus a California versus a Texas Florida, where you would anticipate there would be so many more. How are they managing it? How are they looking at this?
That was the question. One of the things that's keeping me up on this audit is, what if the federal government comes back and you saw the numbers, you saw the amounts. I mean, there were some amounts of occurrences that couldn't be edited that came up into the billions of dollars, according to the letters. And my deal is, what if the feds come back and say, you owe us X amount of dollars, $779 billion. Now, maybe it was not improperly billed,
right?
but because
they didn't code it correctly,
and
right?
you didn't meet the federal standards.
Right.
If you didn't meet the federal standards, it doesn't matter if the payments were done correctly. You didn't meet the federal standards. Here's the clawback, and congratulations, you got a bill for $779 million, and that all takes place very much in the next 3 or 4 years, where nobody's going to remember what the heck went on
exactly
in June of 2018.
Yeah.
And then the other piece that we talked about a little bit is, this is what's called capitated rates. So years and years ago, if a service was delivered, a fee was paid to the provider. Right now, the managed care organizations take all these historic numbers of expenditures, and they have contractual rights to negotiate with the department, and they get so much per month per member. So there's a capitated rate of like $450 is around that number that each managed care plan gets per member. Well, if there's more historic expenditures when it comes to contract, so that could mean years and years of historic numbers that could basically just multiply into
data.
Exactly.
And so they're getting maybe more per person than they should be getting.
Exactly. And that's where it snowballs.
And so then the taxpayer's on the hook.
And it all comes back to, if you don't have good factual information,
then how do you know whether or not that's true or false?
Do you think it makes sense? We have a little bit of time.
We have a little bit.
Does it make sense to just say, okay, what's done is done, but on August 1st, if you're going to be reimbursed, we need every field in this form, and just do maybe a reauthorization or reaccreditation.
Yeah. And do the people in the department, are they not trained well enough? Do they not know what's going on?
I don't know.
She said when she responded that she used words like she will explore, review, consider, and seek as feasible, kind of in parentheses, mechanisms to address. What do you mean you're going to seek it if it's feasible? You better seek it and find it out.
Yeah,
what do you mean you're going to see? It's
probably part of the job.
If you can figure it out, you'll do it.
That's
concerning.
That was the audit information that came back to the auditor from the department, and that's what kind of just triggered the letter, because there had to be more information. And in her letter, to her defense, she responds that moving forward, Rob, they are getting the information and the edits to make sure that happens. I hate to say it, but I want to see it. I want to see that the edits are properly.
Well, I think that's only fair.
And as you
trust but verify.
Right, absolutely. Because as you just pointed out, we may be paying an inflated price per person for each person that's in the Medicaid program.
Without good factual data,
we don't
it's hard
know
to
for
know.
sure.
It's hard to know.
That's not fair to us as taxpayers. And especially, God help the poor people like this who have to use Medicaid. It sucks.
Who needs the services? Yeah, I've not had anybody call.
Services.
That's right. I've not had anybody call me up and say, "I am having a wonderful day today. I'm on Medicaid."
Right.
I've never had those calls.
Right.
But if you don't get this corrected,
if we can pay $200 per person instead of $400, we sure better know. I cannot believe that we don't have an answer to this question.
Well, we're gonna find out, as Rob said, moving forward where we go next.
And it's not about anything other than a big, fat, bloated bureaucracy, because we know it's the same thing across the country. But it's got to stop somewhere. And for once, maybe Louisiana can be that shining beacon that says, we're going to figure it out and we're going to do it right.
And I have to give the legislature credit. I mean, there was an issue that we talked about during the break called pharmacy spread pricing.
Tell us about this, because they did what they passed is something that will help the consumer.
Oh, yeah, that was some legislation that basically any of the rebates that the drug companies give to the managed care organizations, those rebates have to be shared now with the consumer. That's not just Medicaid, that's private
that's anybody.
pay. And that's important. But the other piece that's really crazy is, in the Medicaid program, there's 5 managed care organizations. Of the 5 managed care organizations, 3 of them own prescription benefit management companies. And what they do is they do the processing for the companies.
Okay.
Well, we found out that off of one of the audits that came in, reading it, I looked at it, and there was about $44 million of what's called spread pricing.
What?
And in a nutshell, to condense this, it's
Yes.
basically first cousins dating first cousins paying each other to date them. That's kind of what it is. We could talk people in the face.
But we have a great government, and there's no misspending, and there's no, and then they wonder why people call talk shows. And bitch.
So we passed some legislation that basically said spread pricing in Louisiana for Medicaid is absolutely prohibited. And any rebates these companies get, because when we were fee for service, the state retained 100% of the rebates. Now, the basic legislation says that they shall not retain rebates. And I see you laughing, Bernie.
I'm sorry.
No, and
because
I'm
it's
serious.
all these people that sit in their little happy worlds. That's not real. You people, you just want to talk about things that don't exist. And, it's just because you're not compassionate. No, maybe I have half a brain, and I thought, well, maybe people should ask some questions.
Yeah,
because the first cousin is related to the first cousin is doing business with the. Because you see, I'm a big dummy, and I sit at home and I don't talk to my first cousin. I'm the idiot because I'm not getting but it's loopholes.
Yeah, but you just have, and then they all just kind of support each other.
Well, what it is I own the big, massive managed care organization. I contract out with the pharmacy benefits company. You know your prescription card, you might pay $5 for it. Well, they do the administration of the program. Well, what came out in the audit a couple of years ago was basically that the managed care organization was getting charged by the prescription benefits company to administer the program. Well, they both owned each other.
Yes.
They owned each other.
Yes.
So when I read
I'm going to set my price boo-boo over here, but it might be nice over here.
So
that's a nice deal, Shy.
And that's what's called spread pricing. If any KPL listeners want to Google a pharmacy spread pricing,
you know why we're
stupid
stupid as taxpayers? Because we are not spreading that jam all over our toast.
Well,
but somebody is. That's a nice deal.
And what we have to do is, and listen, I make a mistake every day just getting up, but you have to. What I'm concentrating on, and like I said, I make a ton of mistakes, and we all know it. But I think what taxpayers and everybody has to do is you look at the audits that were independently done on any department.
Anything.
So anything that the open checkbook's good.
Yes.
But I think with anything that you have a passion for, I don't care if it's roads, coastal restoration, education, there's audits that come out by independent folks.
Oh, yes.
And those audits really sometimes have some major issues in it. Now, I have to say some departments get squeaky clean audits. You'll never hear about them, and that's kind of what we all do. But I will tell you, one audit that came in horrible a few years ago was the Board of Dentistry. They had 8 major audit findings. You know what we did legislatively? They were in New Orleans. We passed legislation that they could not be domiciled in New Orleans. They had to move to Baton Rouge because we wanted them right by the Capitol to come anytime we needed to hear them on something. It has changed dramatically the behavior of the Board of Dentistry.
Like how?
Their last look at by the auditors was highly improved.
So was there like a lot of money that was wasted, would you suggest, or no?
What they had done in the audit was there was one dentist that had like a $10,000 fine because he or she did something. And there was another dentist that did the exact same thing and had 0 fines. And the one that had a 0 fine wasn't on the board of dentistry, but was on the board of dentistry. The guy that got the 0 fine. The poor guy that got the $10,000 fine was not on the board.
The club.
So what the legislative auditor said was there was a major disparity in the way fines were basically
called for, basically.
And that's not fair to somebody that has a license that you're getting home cooking for one person, the next guy's got here. Yeah. So when we got the audit,
it's the Hillary and Bernie thing all over again.
Yeah. So when we got the audit, the Health and Welfare Committee called them in and said this is not acceptable, and they basically at that moment in time said, "Well, we the Board of Dentistry and we do what we want to do," and we said using your language, "Well, then boo, you're going to leave New Orleans, you're going to come to Baton Rouge,
and we're going to babysit you,
and we're going to babysit you."
So what you're saying is people should constantly look at these audits.
The audits are the keys.
Way more than we possibly can, because one organization can't do it.
You really
can't do it all. But we do every time they send that stuff out and they embargo it for Monday. One of us has looked at it before Monday rolls around.
Yep. You have to look at them, and sometimes, like I said, sometimes you get some great audits.
And they are. They're
departments,
great,
and
which is wonderful.
Be commended. But the ones that you don't, as we said early in the broadcast, that's the ones you have to concentrate on. So,
see, Senator Fred Mills, I appreciate your time joining us for this hour. I mean, I think there are a lot of things people, because they don't interact with it every day except to be frustrated every time they go pick up a prescription and it's more expensive, or they go to a doctor and maybe their copay has changed. Sometimes that's the only time they deal with it. So thanks for the information as always.
Well, I depressed y'all so much I left a complimentary Prozac on both of you guys.
Okay, thank you. I appreciate that. All right, it's 8:52.
Thank y'all.
Thank you, Todd Peel.
You're welcome, Sha.
All right, it's Tuesday, July 3rd, 2018. We're back to wrap things up for the big holiday tomorrow. That's next, coming up.